Hey, welcome. We're so excited. It's near the end of a very busy year. 2016 is almost over, and boy, has it been exciting. I'm Dr. Steve Grinstead. I'm the co-founder and chief clinical officer for A Healing Place The Estates in beautiful Camarillo, California. We're sitting right now in our residential group room where we're going to be help healing people. It's been such an exciting journey. And my colleague here, Dale Ryder, is a licensed clinical social worker from Arizona who is coming to join our team. She is very helpful when it comes to developing our experiential, spiritual, and family curriculum. So Dale and I have had the privilege of taking the first cohort of people through our lowest level of care, which is our intensive evening outpatient program, which is 4 days a week for 4 hours each day. And we're very excited about some of the outcomes, but I'm going to let you hear that from Dale.
Yeah, it was an exciting time. It was a growing time, a learning time, and to really walk these clients through the whole process of managing their pain and freedom from their suffering, and really looking at the family components. I think what came and really stood out to me was they didn't think that the family pieces were all that important, and what they really learned was family traumas and their spiritual base are very, very important to their recovering from suffering and really moving into that piece where they can manage their pain in their lives.
Exactly. And boy, Dale and I had very high expectations for this first cohort, but they blew it out of the park. I mean, they hit a grandstand home run, these patients that we took through this process. One of the things that all of them seemed to share was a tendency towards social isolation.
Yes.
And what was amazing by using our closed cohort system, what I mean by that is all of our patients come in as a group, they go through as a group, and they go into continuing care alumni as a group. But what happened with this group was phenomenal. By the end of the first week, they were seeing each other as teammates. In week 2, they became sisters. And they started calling each other to be their accountability partners. By the end of week 3, they were going on social outings on the weekends. We never envisioned that. We didn't tell them to do that. This is what they knew they needed to do. So it's been very exciting. When we have this triple diagnosis pain program, we need to deal with people at all those 3 core areas. We need to look at their medication management issues, we need to look at their chronic pain issues, and we looked at the coexisting mental health issues. So we have an amazing curriculum. We're going to be starting soon after the first of the year, our first intensive day treatment, which will be 5 days a week for 6.5 hours a day, with our patients living in this beautiful transitional living home until we get up and licensed and ready for our residential component, which should be about April or May. So I'm very excited. And what has been the biggest hit of this cohort with you, Dale?
Well, I think that piece of them really just bonding as a unit. It's different than traditional treatment, addiction treatment. This is really focusing on that chronic pain. They're beautiful people that are out there just living their lives and really impacted, though, by chronic pain at the base and the isolation that they go through. And they really bonded, these women bonded, and they still text each other, and they consider us part of their team. Instead of us diagnosing them and telling them what's wrong with them, we became part of their team. So that piece was just really beautiful for me to watch.
And they saw us as their coaches
Absolutely.
and guides, not as their therapists, which was an amazing transition for them. Because all of them had been in some form of therapy or under the magnifying glass. And one of the first things we remind them is you are not your diagnosis, you have a diagnosis. If you want to learn more about our program, you can check out our beautiful website, www.healingplacetheestates.com. And don't worry, because if you're watching this video, there's accompanying text and you'll see a link to our website. And we also have a phone number that you can call, 844-381-4100. And we encourage you to call. If you or someone you love has chronic pain and coexisting problems and needs a triple diagnosis treatment program, call us first. If we can't help you, we'll hook you up with someone who can. We're accepting most insurances and definitely private pay. We're one of the programs that will accept cash payment. And, we want to help people. Our goal is to really help people. And like I say, this is a beautiful place. Our outpatient program is centrally located on the corner of Rosewood and Daly. Our address is 601 Daly Drive, and we're in Suite 205 upstairs. But don't worry, because if you're challenged with mobility, we do have an elevator. So we really want to help people. If you want to come by and visit, 601 Daly, please do. But let us know ahead of time to make sure somebody will be there. But call our 800 number, the 844-381-4100, and we will help you. We're very excited about this because, as many of you watching this know, we're in an epidemic with chronic pain and opioid addiction. In the last 4 years, addiction to prescription opiates has gone up over 1,000%. You heard me right, that's 1,000%. We want to be part of the solution for this problem. So at A Healing Place, the Estates, we are ready to meet it. We're throwing in our whole team. We have an exciting group of co-founders, myself, Dr. Joseph Cabaret, who is a triple boarded MD in pain management, addiction medicine, and interventional pain management. John Stenzel has had over 30 years at top executive levels in the behavioral health field. And I've been working with people with chronic pain and coexisting disorders, including addiction, since 1984. Dale brings over 25 years of her experience working with people suffering and helping especially the spiritual and family pieces. As we were developing the program, we needed to have some manualized treatment approaches, but we also needed some experiential. We needed the family piece. And tell them a little bit more about what we do in the spiritual and family pieces, Dale.
Well, with spirituality, I don't like to think of that as religion. It's really just getting people to connect with their strength of who they are. So really leading this cohort in particular was all women into that space of really realizing their strength and what they were brought here to be and to do and to give. So that's really where I focus on spirituality, is walking from that place of strength. And then, of course, we can't leave the family component out, which we tend to want to do because sometimes it's really painful.
It's ugly. It's hard.
Or we don't think that it really matters. And what, like I said earlier, what they learned was it really does matter and it has an impact. The snapshots that we take of our family stay with us, and it's normally those negative ones. So we look at it in that way. And we're going to let Steve talk a little bit more about it, but we have some breaks in our programming where we're going to also be offering something for professional therapists and other people that are suffering with chronic pain. So I'll give that back to you, Steve, to talk about that.
So as we were developing, all of our programs are 6 weeks long, and we can fit 4 of them into a year. And what's happened was we had some blank spaces. We had some spaces, 4 weeks, that were going to be kind of open. And as the team was talking today, our CEO, John Stenzel, says, at the last program I was with, we had what we called a professionals week. We brought in professionals that needed help in this focus area. So what we want to reach out to is healthcare professionals who are living and suffering with chronic pain, and especially those that are in recovery from some substance use disorder, because they do not want to relapse. But any healthcare provider with chronic pain should come to us for 2 reasons. You can stop suffering, and when you learn something, you can teach it to others and help others stop suffering too. So we want to offer a week-long intensive. People will come in on Sunday afternoon for orientation and meeting the team. And then Monday through Friday, we have an intense program scheduled. And then on Saturday, we end it with equine therapy and a conclusion graduation ceremony. It's going to be a powerful week. You're going to get to meet some of the other team members if you come to this professionals week, including our medical director, Dr. Cabaret. He is going to be doing a piece on recovery-friendly medications and safe, effective medical interventional procedures. And we are so excited about all of this coming together. We are having a lot of people calling and say, wow, this is something that's been really needed. And they're not wrapping their heads around it somehow, because a lot of programs, a lot of addiction treatment programs say they help chronic pain patients. But many of them just plug it into their existing model, mix the population in with addiction people that don't have chronic pain, and there's all kinds of trauma and drama. We are different. If people's primary problem is the addictive disorder, we're going to refer them somewhere else until they get that stabilized. If their primary is a mental health disorder that's out of control, we're going to refer them somewhere else till they get stabilized. We want people to hit the door ready to work. And we will offer them transitional medication-assisted addiction treatment as needed, but the major problem has to be chronic pain. We do not want to treat traditional alcohol and drug addicts. This is not what we do. We are treating the triple diagnosis problem: chronic pain, addiction, and mental health. And many of the pain patients I've worked with since 1984 have had a significant trauma history. And that is one of the pieces that Dale and I are committed to making sure that we address adequately for people. And we have 3 primary levels of care once we get licensed and certified. And we will meet people where they're at, and if they don't make it at the evening level, we'll put them in the day level. If they don't make it there, we'll put them in the residential. If they finish the residential but they're not quite done, we'll step them down to the day treatment. If that still isn't enough, we'll step them down to the evening program. So we have up and down continuum of care, in addition to a follow-up for a year of continuing care, live and virtual. And we are very excited about our alumni. This first cohort, they literally begged us to be part of the alumni, and they want to come in and talk to the new groups. And I know that when that happens, we have a winner. The people that we serve are our best marketing talent, and they are really excited about wanting to help others now that they've finally found a way to stop suffering with their chronic pain. Any closing thoughts?
Yeah, just if you're in need, please call us. We have a really incredible, packed program put together, and with all of our years of experience, I believe that we can help and that we are helping. So look up the website and give us a call if you need us.
And again, that's www.ahealingplacetheestates.com. And we also have our own Healing Place Facebook page. Make sure to check that out. And Dale and I both have our personal Facebook pages that we'd welcome you to come by and like. We'd like more likes. And I also have a chronic pain support group on LinkedIn that has over 8,000 people in it, and I would invite you to join that one also, especially if you're a healthcare provider. We really want to make a difference. We are at epidemic levels, and we want to be part of the solution. This wave has been coming for a long time. When I first started talking about this and researching this back in 1996, everybody thought I was crazy. They didn't see the issue. And all of a sudden, the blinders have come off, the stress levels have gone up, the Center for Disease Control is issuing opiate prescribing mandates now, the Drug Enforcement Agency is out there challenging overprescribers, and unfortunately what's happening, and I've seen so many posts just this week, of pain patients being totally and suddenly cut off from their opiate pain medications. If this is happening to you or someone you love, call us right away, because you don't have to suffer. With our incredible team, we'll help you. And our medical director just opened his own new pain practice right in the same building as our outpatient program on Daly Avenue, at 601 Daly Avenue. Our suite is 205 and his is number 228. And I really want to invite you to reach out to us and share with people that can benefit from working with us. Tell them about this. And after you watch the video, make sure to check out the website, please. And as always, onward and upward. and thank you for your attention today. We really appreciate it, and we are so excited to be starting this new year on such a high note.
Thank you.